Hey everyone, and welcome. So, if you're a pharmacy student and you've got exams coming up, you are in exactly the right place. Today, we are diving into a really crucial topic, the excipients in semi-solid dosage forms. These are the ingredients that can literally make or break a topical medication. So let's jump right in. Just think about it for a second. Okay, so you've got your active drug, right? The thing that actually does the healing. But how on earth do you turn that into something stable, effective, and actually pleasant to use, like a cream or an ointment? What's the secret sauce?
Yep, you guessed it. The answer is excipients. They really are the unsung heroes in the world of formulation. I mean, they're the non-active ingredients, but without them, the whole thing just doesn't work. And that is exactly what we're going to break down today.
Here's our game plan for this explainer. First, we're going to talk about what we're even trying to achieve. What does an ideal semi-solid form look like? Then we'll get into how excipients help us do that. From there, we'll zoom in on the specific ingredients you really need to know for your exams. And of course, we'll wrap it all up with a quick recap to make sure it all sticks. Sound good? All right, let's start with the end in mind. Because, before you can really get why each ingredient is so important, you got to understand what the final product is supposed to be. What does that perfect topical preparation actually look and feel like? So what are we talking about here? Well, officially, we're talking about stuff you put on your skin, right? And it's designed to work either locally, like right on that one spot, or systemically, which means the drug actually gets absorbed into your bloodstream. And you know these guys, ointments, creams, gels, pastes, the whole lineup. Now, what's really interesting here is that this checklist sets a pretty high bar. Think about it. Physically, it has to feel nice on your skin. You want it smooth, not gritty or greasy, right? And it shouldn't stain your clothes. Physiologically, it absolutely cannot irritate your skin. And then when you actually go to use it, it needs to be easy to apply. It has to release the drug properly. And hey, it'd be great if it washed off easily too. Trying to get all that from just the drug powder? No way. It's just impossible. And that's the perfect lead-in to our next section. If all those properties we just listed are the what we want, then excipients are the how. They are the toolbox that lets a formulator actually build that perfect cream or ointment from the ground up. There's a line in the source material that just hits the nail on the head. So what does that really mean? It means even though they're non-active, they are absolutely essential. They keep the product from going bad on the shelf, they make sure it works when you use it, and they make it pleasant enough that a patient will actually use it. You take them away and all you've got is a pile of drug powder. Pretty useless. Okay, now we're getting to the heart of it. This is the part you'll definitely want to have your notes out for, especially for those exams. Let's really dig into the key players, the main types of excipients, and crucially, the examples you need to remember. Think of this as your exam cheat sheet. Let's break this down row by row. First up, preservatives. Their job is simple. Stop microbes from growing in the product while it's sitting on the shelf. Think methylparaben or benzoic acid. Next, humectants. These guys, like glycerin, are all about preventing the cream or ointment from drying out. Then we have emulsifying agents. These are so important for creams. They keep the oil and water parts from separating. A classic example is polysorbate. And finally, antioxidants. Their role is to be bodyguards for the active ingredient, protecting it from being destroyed by oxygen. Here's a super simple trick to remember what humectants do, because they pop up on exams all the time. Just think, humectants hold on to moisture. Simple, right? But trust me, a little memory aid like that can be a real lifesaver in an exam. Okay, we've gone through the main players. It's time to bring it all home with our final section, the exam recap. This is a super quick, rapid-fire summary of the absolute essentials you need to walk away with. Okay, let's nail this down. Number 1. The goal for any semi-solid is simple. Make it smooth, non-irritating, and easy to use. 2. Excipients are the behind-the-scenes heroes that make that goal a reality. 3. Remember preservatives like methylparaben? They stop germs. 4. Humectants, like glycerin, stop it from drying out. 5. Emulsifiers, think polysorbate, are the peacekeepers between oil and water. And number 6. Antioxidants protect the drug itself from breaking down. Got it? Good. And this really gets to the heart of why all this matters, beyond just passing an exam. So I'll leave you with this question to think about. Now that you know what these things are supposed to do, what happens when you pick the wrong one? How could one bad choice, a preservative that irritates the skin or an emulsifier that just gives up, completely ruin an entire formulation? That's where the real art and science of pharmacy comes in. Thanks for tuning in.